Welcome everyone again, and good afternoon to this webinar on building respite registries. We really have a great agenda for you today, and we're going to learn a lot. I'm going to learn a lot, and you're going to learn a lot. And I'll start out the meeting by sharing a little bit of context for why we're doing this respite registries right now. And how the issue emerged from our larger initiative that we're doing on respite provider training that some of you may have heard me talk about before. And then we'll have a national overview of direct care worker and matching registries from a very knowledgeable colleague at PHI, and then hear about specific examples from several Lifespan Respite grantees and their partners, and a former Lifespan Respite grantee. And then conclude with information about a specific type of respite registry that's functioning in a few states that was developed and maintained by Rewarding Work. And some of you may be familiar with Rewarding Work as well. Each presenter is going to do their presentation, and we'll take questions at the end, except for when we hear from our Nebraska colleagues, because they have to step off a little bit early. So we'll pause right after theirs for questions, but then take questions at the end. So feel free to write your questions in the chat box at any time, and we will get to them at the end. Our presenters today, I'm really so honored to have with us today, Stephen McCall, who's the data and policy analyst at PHI. And for those of you who may not be familiar with PHI, it really is among the foremost national leaders in research and advocacy on the direct care workforce. And it's my go-to place whenever I have any question at all about the workforce issues, policy, research, numbers, whatever it might be. That's where I go for information. Then representing the Nebraska Lifespan Respite Network, we have Hannah Queering, who's the Lifespan Respite Program Coordinator there. And she's accompanied by Jessica Cook, the Web Project Coordinator, based at the University of Nebraska at Lincoln. And then it'll be followed by Val Madsen, the Training and Developmental Specialist from the Respite Care Association of Wisconsin. Sarah Schmidt, who is the Lifespan Grant Manager at the Arkansas Department of Human Services. And then finally, Teresa Driscoll from Rewarding Work. And I'll let them all introduce themselves a little bit more when they are doing their presentation. Many of you are, as I mentioned, are familiar with a recent initiative of ARCH that was funded by the Administration of Community Living called the Respite Provider Recruitment Training and Retention Pilot. Our very, very important partners in this initiative are the National Academy for State Health Policy, who's the lead on the project. And there are other components to the project as well, but the impetus for the webinar today really came from the training initiative. And we've also partnering with the Respite Care Association of Wisconsin, and the evaluation is being conducted by Dr. Kim Whitmore at Marquette University. If you want to read a little bit more about the initiative, you can find it at the link on this slide. And I'll put any link that I'm referring to in the next couple of minutes, I will put in the chat for you, so you'll have more direct access to them. I know that all of you know from your own experiences working in the respite field and from what we hear in the news every day that we are really in the midst of a direct care worker shortage that's rapidly escalating to a crisis if it isn't a crisis already. There just are not enough workers to provide home care, personal care assistance, and now, and has been for a while, even respite services. And we have so many family caregivers coming to us who say, I have the Medicaid resources or I have Lifespan Respite funds, but I just can't find a provider. And so to contribute to helping address this issue, we receive these funds from ACL and to work with our partners to test and eventually scale a respite workforce program through evidence-based training and recruitment strategies that we hope will increase the pool of well-trained respite providers to better meet respite families' needs. And at the heart of this intervention is a new competency-based entry-level respite provider training and recruitment campaign that we're now field testing in 11 states. We developed using through an expert work group, including someone from PHI, a set of specific respite provider core competencies. And if you want to learn more about those core competencies, how they were developed and how we use them to enhance the training curriculum, I will put those links in the chat, as well as actual descriptions of the training itself. And the states where we are piloting this respite provider training and recruitment project, you can see on the map, it's Arkansas, Illinois, Kansas, Massachusetts, Montana, Nevada, New Mexico, New York, Oklahoma, South Carolina, and Wisconsin. And some of the state leads are Lifespan Respite grantees, but not all of them. In 2 states, Kansas and Massachusetts, the lead on the pilot is Rewarding Work. All of them, though, had to demonstrate that they would be able to recruit providers statewide and ensure that they would be seeking providers who would be able to serve individuals of all age groups with any disability or special need. And you can see that we were very fortunate because we got a really very good geographic distribution across the country of our pilot sites. The need for information about respite registries came from many of these pilot site leads who expressed their interest in developing respite registries so that as more providers were recruited and trained, they would have meaningful ways of capturing who the providers were in a centralized database. They would have at their fingertips some organized strategies for staying in touch with these providers. And then, of course, be able to offer user-friendly platforms that could help match family caregivers to these providers. And, ultimately, this is about the family caregivers and making it easier for them to find people to provide respite services. So that was the impetus for the webinar today. And I just wanted to give you that context. We're so fortunate to have within our own network several states that have implemented successful respite registries, and I'm really excited to share their work with you. And we're also so grateful to Stephen from PHI and Teresa with Rewarding Work to also share their expertise and guidance today for those of you who want to move forward in their space. And I know they'll have lots of resources for you. So without further ado, I'm going to turn it over to Stephen to provide the national picture of matching service registries and offer some really wonderful resources for you. So go ahead, Stephen.
Thank you so much, Jill. I really appreciate the introduction. Just by way of background, my name is Stephen McCall. I'm the data and policy analyst. In my role at PHI, I track policy and practice trends in all 50 states, and also I'm our lead data analyst on the policy research team. So among the various projects I work on, I am focused on sort of keeping track of matching service registries across the country. I've been in my role for 8 years, and I think what makes me so excited about today's event is this is the first time that I get to connect with folks like you directly to talk about this research, to talk about these tools, and to provide, technical support and, whatever other support, I can provide. So for today's presentation, I have a couple of aims. First is just to give you a pretty broad overview of what we found in our research on matching service registries, including how we even define what a matching service registry is and isn't. And then in the latter half of my remarks, I'm going to focus on what we've learned from registry operators about best practices in getting started with a registry and maintaining and sustaining those registries in the long run. Next slide, please, Jill. So before we get to all of that, I also wanted to orient you a little bit to who we are as an organization. PHI is a nonprofit research and consulting firm that's really focused on improving the quality of long-term services and supports for consumers across settings by improving the quality of jobs for direct care workers. So folks, including respite workers, personal care aides, home health aides, nursing assistants, really a wide range of job titles and responsibilities that we're focused on. We do that in a number of ways. On my side of the organization, the policy research team, like I said, we're sort of tracking best practices in policy and practice at the national level. We're advocating for workforce policies at the state, local, and federal levels. And providing technical assistance to states and other actors to implement sort of broad-based reforms for this workforce. But there's another side of our organization as well called the Workforce Innovations Team, and they're working directly with employers and others on the ground to implement elements of a high-quality job, like supervisory interventions, training interventions, and similar sorts of on-the-ground interventions. And importantly, these two sides of our organization, the research side and the practice side, very much inform each other. So their work is informed by our sort of big picture work on the policy side, and our work is very much informed by the on-the-ground experiences of workers, consumers, and unpaid family caregivers. Next slide, please. We focus on matching service registries in our research because these technological tools really perfectly embody that kind of mutual need of consumers and workers. So if we go to the next slide, I just want to share how we define a matching service registry. We think that these are online job boards that first enable consumers to contact potential workers based on their needs and preferences and potential workers' availability. And second, these online tools help home care workers find clients to build and sustain the work schedules they want, right? So there's this real mutual benefit that these technological tools can provide. And when I use the term home care worker, I mean, I'm largely referring to, for example, consumer-directed workers under state Medicaid programs, but certainly respite workers are part of this workforce as well. Even if they're a family member or a friend of the folks that they're assisting, you know, we would still consider them as part of this broader workforce and folks who could potentially benefit from these tools. Now, importantly, in our research, we really focus on registries that are free and accessible to those who need them. So we're focused on registries that are either grant funded or publicly supported so that they're free to use for users. So for example, a website like care.com is not a part of this research for us. Next slide, please. So here's what we found in our research on the national landscape of matching service registries. Currently, there are 14 registries that are live in 10 states. 9 of those registries are statewide and 5 are regional, usually covering a service area of an individual county or a cluster of counties. 7 of those registries use a shared online platform, including 4 that use QuickMatch, which is a registry developed by the Marin Center for Independent Living in California, and 3 that use Rewarding Work, which, as Jill mentioned, we're going to learn more about later today from Teresa. 11 of these matching service registries are maintained by nonprofit organizations, and 3 are maintained by state agencies. Now, I want to pause here and sort of make an ask of all of you in the audience and among the speakers today. If it feels like we're missing your registry from our research, don't be afraid to reach out to us directly and let us know. A lot of this research is based on word of mouth, and we really rely on our connections to folks in the field, which again is another reason why I'm excited to participate in the event today, to learn more about registries that perhaps we've overlooked. So I'm thrilled about that. And again, please feel free to reach out. I'll be sure to share my contact information at the end of the presentation today. Next slide, please. And I also wanted to share this map of where these registries are distributed. Most of them are in the Northeast and on the West Coast. I mentioned those quick match registries. They were started by Center for Independent Living in California, and most of those quick match registries are located in California. And a kind of wonky note here, in Massachusetts, there are actually 2 statewide registries. So even though I said there are 9 statewide registries, they're present in 8 states. Next slide, please. So beyond keeping track of these kinds of high-level trends in matching service registries, I also wanted to provide you with some of what we've learned from registries themselves. A lot of the research that we include on our website is based on conversations we've had with registries across the country. So I wouldn't say that I am an expert. I haven't had the hands-on experience of launching a registry, but I've spoken to a lot of folks who have. So in this latter half of the presentation, I just wanted to share a little bit about what we've learned on that front. Can we go to the next slide, please? So the first step of the 5 steps I'm going to go over today in launching and maintaining a registry is to start by engaging with workers, including respite providers and others if appropriate, consumers, people with disabilities, older adults themselves, if that's who you're serving, and unpaid caregivers and family caregivers about what they actually need from one of these registries. So some of the questions that you might consider are, is this registry going to focus on respite services exclusively, or will it include other paid supports? Do consumers and family members need workers to undergo a background check before they're listed? Or will the registry otherwise provide guidance on how to go about doing that? And how do consumers and workers want to share their availability? How granular does that need to be? And what matters most in terms of worker and consumer profiles on a matching service registry? Unlike a typical job board, I mean, the ability to develop a close relationship between a respite provider and someone in need of respite is not just about availability. It's also about needs and preferences beyond just time, right? For example, does this person prefer someone who's a non-smoker? That's important to include here. Or does the worker need to know if this consumer has dogs because they're allergic? These are the kinds of considerations that might arise from this kind of engagement with potential users. And then finally, does the registry need to interface with the state training database, or do training credentials otherwise need to be seamlessly integrated into worker profiles? For example, as Jill mentioned, there's this new competency set for respite care providers. Would it be helpful to have a badging system to indicate whether this worker has completed that training? And in these conversations and throughout this engagement, I really encourage you to dream big, to really think about what is that gold standard, most robust tool that you would want to build. And while it might make sense to launch with a more simple minimum viable product to kind of meet that immediate need, gathering all of that information up front can really inform your strategy moving forward, because you can always add new features later. Next slide, please. And then based on what you learn, the next step is to consider whether you want to work with an existing platform like Rewarding Work, which again, we're going to hear from Teresa later today, or do you need something more customized? And I think there are sort of positives and negatives to both, right? Rewarding Work offers something that can work sort of out of the box from day one, right? And there's also downsides to doing something more customized if you want features that are more robust than an existing platform offers. For example, it can be harder to add features later on if the platform you're using and building the registry on isn't as nimble. So I think that the only way you can make these decisions is just by sitting with them, right, and thinking really both in the near and long term, what are your needs as a registry, and how might you meet those? The next slide, please. And this next step can really be among the hardest. How are you actually going to pay for this project and this matching service registry? Some options that registries have used in the past, again, focusing only on those that are sort of free or affordable, are philanthropic grants, state appropriations and funding. So actually implementing these tools legislatively is an option. Collective bargaining agreements. If there's a union presence in your state, sometimes registries can be written into that CBA and get funded that way. And even partnerships with managed care organizations. So these private Medicaid funded organizations may have an interest in funding this tool to sort of maintain a competitive advantage and attract consumers to use their services. And there are other funding models to consider other than sort of these kinds of general operating support or contracts. For example, some registries are free to use for individual workers, but might charge agencies a subscription fee to have access. And again, when it comes to funding, similar to figuring out the functionality of the registry, don't be afraid to dream big, right? Really think about what it takes in terms of funding to achieve what consumers, workers, unpaid caregivers actually need. Next slide, please. And after the registry is sort of more fully fleshed out and developed and funded, somewhere in here, of course, there's the important step of launching the registry, right? I excluded that step here. But a really important element to both starting a registry and maintaining a registry is developing a marketing plan. So how are you going to get the word out to make sure that folks are actually using this registry? Are you going to rely on word of mouth within your network of organizations and partners to make sure that folks are aware of the registry? Perhaps you have existing relationships with fiscal intermediaries or state agencies that have direct interaction with folks who might need respite care. That's another option to sort of build a user base. But one really effective strategy that many registries have adopted is leveraging social media and using targeted ads to reach the folks who are most likely to need these tools. All of this is really essential to both the short and long-term health of the registry, because if one side of the registry builds up faster than the other, for example, if there are more folks in need of respite than there are folks willing to provide respite care, that can start dissuading users from using the registry. Like other sort of marketplace applications, it's really important to build up both sides at once, both the folks who need the services and the folks who can provide them. And that is a long-term consideration too, right? It's helpful to build that user base in the beginning, but continuing to invest staff and financial resources into bringing people into these registries ensures their long-term sort of sustainability and health. Next slide, please. And finally, as I've sort of hinted at here, launching a registry, it's not sort of like a set it and forget it tool, right? It takes a lot of work to maintain a registry, especially depending on, how light of a touch you and your staff will be providing for users. For example, will folks be able to call your organization to get assistance with this registry? Keeping an eye towards evaluation and sustainability is really important. Making sure that not only are people using and registering to use this tool, but what are their experiences once they're in there? Going back to step one of engaging with the users and engaging with different funding models, revising your marketing plans. I think it's really important to sort of rinse and repeat, so to speak, when it comes to developing, launching, and sustaining a registry. Next slide, please. Before I pass the mic back to Jill and we move on with the rest of the agenda, I also wanted to share links to all of PHI's research on this topic. That first link is to our matching service registries research, and the latter three are blog posts that are in-depth interviews with matching service registry operators about the challenges they've experienced and how they've overcome them. So lots of those conversations I thought were so enriching for me, and I hope that for all of you who are interested in these registries, that they'll be helpful to you as well. So I'll be sure to drop those in the chat in just a moment here. Next slide, please. And finally, here's my contact information. My email address is just my first initial and last name at phinational.org. Feel free to reach out if you have any questions about our research and sort of the national landscape, or again, if you would like to include your resources and tools in our research. I would really appreciate that kind of outreach as well. But with that, I think we'll save questions for, as Jill said, after the next speaker and then at the end. So Jill, I'll turn the floor back over to you.
Thank you so much, Stephen. Just chock full of information, and thank you for putting those links in the chat because I know people will be clicking on them right away. And thank you also for inviting some of our registries to be in touch with you about maybe getting listed as part of the work that you're doing and be part of the whole national network. I do want to invite everyone again, as you think of questions, please feel free to put them in the chat. We will get them to them at the end. And I also neglected, if you want to drop into the chat your name and your agency and what state we're from, we'd love to know who's here with us today. With that, I'm going to turn it over to Hannah and to Jesse, and I will advance to the next slide.
Good afternoon, everybody. Thank you so much for providing the opportunity for us to provide information about Nebraska's Respite Registry. My name is Hannah Queering. I am the program coordinator for the Lifespan Respite Services Program, which is through the Nebraska Department of Health and Human Services. I also oversee the Disabled Person and Family Services Program too. And with that, the Nebraska Lifespan Respite Network is incorporated in that. And it provides respite support and services across the state to caregivers, the care recipients, also the providers. And I will go ahead and have Jessie introduce herself as well before we begin.
Thanks, Hannah. Thanks, Jill. And thanks everyone for being here. I'm Jessica Cook. I'm the web project coordinator with the Center on Children, Families, and the Law with the University of Nebraska, Lincoln. We usually just say UNL CCFL because that's quite lengthy. I've been with the center for 16, 17 years now. And generally, I work with many different project partners, Respite being one of them, but many of them are attached to either early childhood or lifespan or aging services. And I do a lot of graphic design and web design, and I'm happy to be here to help cover the services.
All right, next slide, please. So this is the map of our 6 respite service areas that we have across the state. There is a direct contact or a respite coordinator located in each of those 6 service areas, and they are contracted through the Nebraska Lifespan Respite Network. They are there to provide support not only to the providers, but as well as the caregivers and the care recipients. And then also they provide information across the entire lifespan, whether they are part of the Lifespan Respite Services Program with the Department of Health and Human Services, or if they are just a caregiver that is providing that support out of pocket. Next slide, please. So the family members, friends, or neighbors can be utilized as paid providers after they complete our network screening. The network screening is now required for all paid and volunteer respite providers in the state of Nebraska. This was effective October 3rd of last year when our state regulations were amended. Other provider possibilities include community-based organizations, agencies, camps, summer programs, local volunteer-led organizations, therapy programs, equine therapy programs, faith-based. We pretty much are very open as that care recipient is receiving care and enjoying doing something, as well as the caregiver being able to have that break. Next slide, please. So with the NLRN, which is abbreviated the Nebraska Lifespan Respite Network, there are some provider standards that the provider has to agree to. First and foremost, that needs to be that the provider must be the age 14 or older if they are providing respite care through the network. This includes if they are providing respite care for family members or close family friends. They must follow the Department of Labor child labor laws as they are outlined. Then additionally, the provider standards include that the agency or CBO providers must be licensed or certified as it's applicable as required by Nebraska state law. The provider understands that they are also providing respite as an independent contractor and not an employee of the department or the state. Furthermore, the provider will respect the care recipient's rights to confidentiality and, of course, safeguard that information. And they also sign and acknowledge with their application that they are responsible for their safety and their property. So the provider must have the knowledge, experience, and or skills to continue to perform the tasks agreed upon with the caregiver to provide respite care. These are all outlined again on the provider application that they must submit to our network. Next slide, please. So network screening steps include the following, and these are required annually for most of them, and they are of course free of charge to the provider. These will be outlined in the upcoming slides, but those include a provider application, the background checks, and then an online orientation, which the online orientation is only required upon initial application. Next slide, please. So they must complete a provider application, whether they are an individual, agency, community-based organization, or a volunteer. And so the application must be completed, filled out, and then submitted to either a respite coordinator or to the Lifespan Respite Services Program. The information will be entered into the NLRN database, which is utilized for tracking of that screening. And then that also auto-populates the Nebraska Resource and Referral System, which we will refer to as NRRS, when the provider has completed all the steps of those screening. That includes the renewal process too. Next slide, please. So also with the network screening, they are required to complete annual background checks. This is done by the contracted background check provider, and they have to submit to these checks either done via the email option, or they can also do a low-tech option. With the email option, the portal link is sent to the provider and they have to follow the steps as it's outlined within the email. If they choose or elect to do a low-tech option, then those items are mailed to them and they must complete them. With the low-tech option, they have to have the 2 forms notarized before they can be submitted back to us to initiate that APS-CPS central registry check. Next slide. So the provider online orientation is available for providers to access and complete at their own pace. They can do a few slides and then come back to it, or they can do it all at once. Typically, this takes approximately 60 to 90 minutes to complete. They can also, of course, do the low-tech option with this orientation. We will mail them a packet and they have to go through that, and then they have to complete the 12-question quiz at the end and submit that back to us. Next slide, please. The orientation includes basic information on providing respite. It includes respite caregiving knowledge. It provides information about submitting billing or further billing information if they're not being paid through the Lifespan Respite Services Program. It will also give them some information on respite funding sources and other options. Back to the quiz really quick. There is a competency quiz at the end of the orientation that is 12 questions. The provider must complete that, whether it's online or the paper copy. And in order to get that certificate of completion that they have completed that, they have to get an 80%, which is 10 out of 12 questions correct. Next slide, please. I believe Jesse is going to take over from here with the technical side of this.
Right, thanks, Hannah. I'm going to cover some resources for caregivers and providers. So first, the Nebraska Lifespan Respite Network website. And again, as Hannah pointed out, we refer to it as NLRN. But this website contains a lot of useful information for family caregivers, providers, and employers across the state of Nebraska. Potential providers can learn how to become network screened and access required applications. And there's also various training opportunities available that they can learn more about on the website. Family caregivers can find information on best practices when searching for respite providers and information on how to help pay for respite services. And then for today's purposes, I'm going to be highlighting the ways that the website helps caregivers and providers connect through specific features on the website. So next slide, please. So this allows, the tools on the website allow caregivers to search for providers by location and or to complete a brief questionnaire or self-assessment for provider matching based on the needs of the respite care recipient. So that's, we have a search option and a provider match tool. So the information provided is based upon the information included on the application or provided by the agency or organization. And it actually is sourced from that Nebraska Lifespan Respite Network database. Next slide, please. So those tools that I mentioned, the ability to search for a respite provider or to use the provider match tool, those tools are actually, they're actually hosted on and are part of the Nebraska Resource and Referral System, which we call the NRRS. We're big into acronyms here in Nebraska. So, but the Nebraska Resource and Referral System is supported by the Nebraska Department of Health and Human Services and administered by the University of Nebraska-Lincoln Center on Children, Families, and the Law, of which I'm a part. Next slide, please. So the Nebraska Resource and Referral System, or the NRRS, is a searchable database of thousands of Nebraska service providers and organizations. So this includes many licensed service providers within Nebraska, things like childcare, housing, mental health practitioners, dentists, etc. It also includes organizations like food pantries, diaper depots, churches, and more. And so users can find resources on this website through, again, either using our search tool, so search filters, or by using one of our self-assessment tools. And the provider match is a self-assessment tool. So the NRS assists respite providers and caregivers with connecting based on both needs and location. Next slide, please. So here we have a screenshot of the provider match, the self-assessment questionnaire. The user goes through and answers the questions in each of the assessment sections that you can see on the right there. And the users can answer as few or as many questions as needed, just whatever pertains to their needs. Then they can enter the location in which the services are needed, and then the system populates a list of providers that can meet their needs. Next slide, please. So the system shares the information provided by the provider from the Nebraska Lifespan Respite Network database. And that the provider renewal must be completed annually, which includes network screening. So if the provider is not renewed and their screening is not current, they will not be displayed in the NRS. They will be excluded automatically. They can, so based on the information provided on the provider application, families and care provider agencies can review that information and then contact the providers that they think would best meet their needs and set up a meeting or interview. And basically pick and choose which providers and agencies they wish to contact. And that's a little screenshot of what one of the provider details looks like. There you can see we provide basic contact information, location information. We even have a map and it's got a link to provide directions on how to get to that agency or that provider. And then there's additional details of service provided on each of those provider screens. Next slide, please. So providers can indicate on the NLRN application that they would prefer to remain private and not be posted on the NRRS as far as the coming up in a search or provider matching result. So providers can also elect not to be displayed on the NRRS if they want to remain private individual providers for just specific families or friends, or only their current care recipients. And if at any point they choose they change their decision whether they want to be included or excluded, they can simply notify the local coordinator in that service area that they'd like to make those changes. Next slide, please. So the information for screened providers and licensed service providers is updated on the NRRS, the Nebraska Resource and Referral System, through a nightly import. This applies to all imported, licensed, and screened providers. So not only the respite providers, the screened respite providers, but we also, as I mentioned, partner with the Nebraska Department of Health and Human Services. And so that we get a nightly import of the licensed service providers in the state. And so that applies to all licensed service providers, not just the respite providers. So, but in the event of a license closure, or a provider has chosen not to renew, or they change their preferences and no longer wish to participate on the NRRS, that resource is automatically removed from the database. Next slide, please. And I wanted to highlight 2 more features within the NRRS. So as users are viewing the resources, whether they use the self-assessment or they're using the search filters, each resource that appears can be added to a favorite list. So bookmarked or saved for a later time when maybe it's more convenient to review multiple selections at once. To do this, every single resource has a little button. It's as simple as clicking add to favorites. And if you want to remove it from your favorite list, the button changes to remove from favorites. And then again, if there's any closures or license revocations or changes in preferences, those providers are also automatically removed from these favorites lists. So you can ensure that the lists stay updated and accurate, and that you're not looking at ineligible providers. Next slide, please. And then the NRRS also offers the ability to compare up to 5 resources at a glance. So this feature allows users to quickly compare ages served, eligibility, costs, and then a brief description of each of the providers or services. And again, this is available. It's very easily attainable. It's a little button on every one of those resources. It's just compare this resource. You can add up to 5 at one time. And once you reach that 5 limit, it'll just give you a little warning that says, you need to remove one if you want to add one. So again, we tried to make it really easy for the end user. Next slide, please. So we wanted to kind of touch on what the pros and cons are, and between using the online tool and versus reaching out to a live local coordinator. And while there's many similarities between the 2 options, the pros of the online tools are that it's available 24/7 from the caregiver's computer or mobile device. And it gives the caregiver the ability to view provider details on demand. So that means 2 a.m. when you can't sleep, or when the kids are in bed. Or in the case of crisis respite, caregivers can locate providers after office hours if needed. Next slide, please. And then in discussions, the only real con that Hannah and I could think of is that there may be exceptions to the information provided within the provider application. For example, if a provider indicates they'll only travel 25 miles, up to 25 miles, and someone is searching, outside of that area, so 35 miles away, that provider may not come up in that search result. And whereas perhaps a local coordinator would know that information, they would know that this provider is willing to make some exceptions. But unfortunately, databases only know what they are told. So that was the one limitation that we could think of as far as the differences between online versus in-person assistance. Next slide, please. And with that, that is the brief overview of our provider matching tool in conjunction with the Lifespan Respite Network and the Nebraska Resource and Referral System. And we've got both of our contact information there. And in the chat, I'm actually going to paste the two links that we mentioned, the two websites. So the Nebraska Lifespan Respite Network website and the Nebraska Resource and Referral System website.
Thank you both so much. This is really the gold standard, I think, of respite registries, and the Nebraska Lifespan Respite Network has been around for probably more than 20 years. So they've really developed their expertise in this area. So thank you so much for sharing that. We will take just 2 or 3 minutes if there are any questions, because Hannah does have to step off. I believe Jesse might be able to stick around a little bit longer if people have questions about the technology side of it. But if you have any questions about the screening or respite provider qualifications for Hannah before she has to leave us, feel free to unmute yourself and ask the question or type it into the chat. Thank you for giving us those links. Not hearing any questions? Thank you so much. This is going to just be a really valuable resource, just having your slides here, really excellent. So thank you both very much for taking the time. Oh, wait, we do have one question here from Corey in Nevada. She'd like to know, is the Nebraska system part of the state's 211 system?
And I can answer that. It is not. There's two separate systems. So the 211 is a project of United Way. And again, we're a project of the University of Nebraska. So we do have similar resources. So there are similarities between the two, but yeah, they're definitely two different projects.
Good question, Corey. Okay, thank you both very much. Again, you can keep writing your questions into the chat. In the meantime, I'll move on to Val Madsen from the Respite Care Association of Wisconsin. Thank you both, Hannah and Jesse. Really excellent presentation.
Thank you.
All right. Well, thank you so much for having me, Jill. I'm excited to be here with all of you today. My name is Val Madsen, and I'm the Training and Development Specialist at Respite Care Association of Wisconsin. And I'm here to talk about the registry. So next slide, please, Jill. So the purpose of our registry, it's a statewide registry, and it's to connect people, specifically caregivers with trained providers. And that was one of the biggest things when we started the registry about 12 years ago, was there was no centralized spot for people who are trained. There wasn't any training at all for respite providers specifically anyways, but we wanted to have a spot where people, family caregivers, could find people who are trained to provide respite care. So it really is just a way for the caregivers to search the registry to find a provider, set up an interview, ask for a background check, negotiate the specific care needs. Really, our role is to connect. We don't go through and screen any of the providers. We just make sure that they have completed the training, and then we provide training and information for the caregivers on how to screen those providers and how to do the interview process and how to work on background checks and all of those different things. So really, it's a connection and a way to give information. So next slide, please. So we are an employer or a direct provider. Again, it's just the connector between the two parties. The providers that are listed on the registry typically are self-employed, are employed by a third-party agency, or are direct hire by a self-directed consumer or the caregiver. So in Wisconsin, there's not a centralized funding source, which most other states are very similar. So really, we aren't connected to any one type of funding or one type of program, the adult system or the child system. We really are all encompassing. And that's why we provide information and training to both the providers and the family caregivers on how to navigate that system. And instead of trying to create a smaller system in silos, we want to just give lots of information and help people connect that way. It is a responsibility for those listed on the registry as a provider to also make sure it's a good match. And that's part of the training. So in order to be on the registry, the providers do have to complete the respite care provider training. And part of that training does talk about communication with the family caregiver and how to make sure it's a good match. And it has worksheets on, these are things to ask. These are things to think about with your own skills, along with what is a good fit for you. So a lot of our registry side actually is training and making sure people have the information they need. The other side is also for the family caregiver and giving them the information and training on how do you interview? How do you do the hiring process? How do you train someone? So again, that training and information is such a key part of our registry process. So next slide. So it's pretty simple process overall. An agency or an individual fills out the registry form online. You can upload a picture, you can upload a resume, a flyer if it's an agency program, whatever it is. And then our staff are notified that there's a new profile. Staff can review it to make sure that it does have respite services as the service being provided, and then they make it active. So it really is a very basic system where people fill out the information, they include any information they want. We do also, again, the training side, we have training for people who are filling out the profile on what makes a good profile. What are some things you could include? What should you include? So again, giving people information, but then they also have control over what they want to share and what information they want on their profile. The profile is available to be searched directly from the website. Providers receive an automatic email to log in and update the profile 6 months from the last time they've logged in. So that was really important when we were choosing our software for our registry, is to try to have things more automatic. So that we do not have a big staff to manage this. And so we really wanted the system to work within itself. And so automatically at 6 months, if a provider has not logged in, they get an email saying, hey, make sure you go in and update your information. And then if they don't log in within a certain period of time, they will be made inactive and won't appear in search results. So that's the best way we can make sure that the provider profiles are staying current, and it's people who are responding to messages from the family caregivers. Next slide. So on our website, this is what a family caregiver sees. So it's a very basic search tool. Again, there's a link there to go to a course and with worksheets and checklists on how to hire someone or how to recruit someone. Oftentimes in Wisconsin, case managers will tell a family, you have respite funds, but you have to find your own provider, and they're on their own. So again, more information on how to do that. But really, it's very basic. You search for the county you're looking for, the ages, and the type of respite, in-home or community-based. Then you get a list of providers. There isn't a fee on either side for the family caregivers to search or for the providers to put a profile up. We wanted to make sure that it was free for all parties involved. Next slide, please. So then here's an example of what a profile looks like. There's basic information, name, email. You can add in like a resume or a flyer right here where it's a clickable link so that you can go and it gives you more information. And people can choose how much information they want to put in and really figure out what they want to share, what's important for them. But it's all right there. We chose not to do a lot of the check boxes because we didn't want to limit some of those search fields, but we have the ability to make more check boxes. So if we wanted to go in and have specific things that people can check off, that could become a searchable field as well. So it's really customizable for the needs that we have. Next slide. Coming soon, hopefully in the next month or so, is kind of a reverse listing where the caregiver will be able to post that they need care and help and kind of post like a job listing, and providers will be able to search through those caregiver listings as well. So that's something that we've worked with the developers in creating and developing, and we're really excited about that. And we're hoping to link it in the future to like an emergency respite system, where if a caregiver really needed some emergency respite, we would be able to have a caregiver registry listing and be able to send it out to providers that are on our registry, because it's all linked in one system. So we're really excited about kind of the potential that we have here. So next slide. So the software that we use is called Gnosis for Nonprofits, and it is really a database system that supports nonprofits, but also government agencies, that really is not originally designed to be a registry. But we were able to work with them and create one for us. So kind of like Stephen said at the beginning is, do you take an out-of-box registry that has lots of features, or is it something you create on your own? And that was the route we went, because it just fit really well for our organization. So next slide. The reason we went with it is because it isn't just a registry, but it also includes like event management, communications, record keeping. Everything is all in this one database. So that's where that emergency respite system might work out really well, because we can send communications, emails, newsletter, texts right from the system to people on our provider registry. It's all integrated, it's all involved, it's all combined in one spot. So we're really excited about being able to work with the software and be able to build and add more onto it. And next slide. So then kind of pros and cons. So, it was built for us and our needs. We were really able to develop it, and what we want on our own is linked to all these automatic features or communications. We're able to upload pictures and resumes. And it's also easily customizable. So like I mentioned, if we wanted to add checkboxes for different trainings, or if we wanted to be more specific about care needs, we even had some suggestions from some users about, other types of care outside of respite and maybe light housekeeping or respite and light maintenance, something like that. We could add checkboxes for that. So we can customize and design whatever we want within our registry system. So we're really excited to continue to build that and see where that's going. Cons, because there's not a lot of design options. It definitely did not look as pretty or as cool as Nebraska's. And being able to compare people, again, like Jill said, gold standard, they have a great system there. We have text boxes, so they can be hard to read, and it's really dependent on what people put in there. So that's where it goes back to us training our providers, giving them the information on what makes a good profile. It's hard to track searchers on our end, because anyone can go to our site and search, and we're more so tracking through just like Google Analytics on that side. But that was a choice we made. We didn't want to have the caregivers having to sign in and create a profile in order to track them. So again, there was ways we could have done that, but the way we have it set up, we really can't track as easily the search side. And then using Gnosis, they're a small agency as well. And so they have a small team working on lots of different projects. So sometimes it's hard to really make some of these things happen, but they're willing to work with us and customize a lot of things. So that is kind of the overview of the Wisconsin Respite Registry. So next slide. And I think we'll do questions at the end, but there's mine and Lisa's contact information if anyone has any questions outside of here. But that is all I have, Jill.
Thank you so much, Val. Again, another really wonderful system, and one that I know the staff at Respite Care Association of Wisconsin put a lot of thought into making it user-friendly for caregivers, and it certainly is. And tying it to the training piece, I think is important for many of us that are working in this space. So thank you very much. And I'm now going to advance to Sarah Schmidt from Arkansas.
Thanks, Jill. And I cannot get my camera to work. I think it's time for a new webcam over here. So you'll just have to pretend you're looking at me. You can go ahead to the next slide. So kind of give you guys a little background. My name is Sarah Schmidt. I'm the Deputy Director for the Division of Provider Services and Quality Assurance, or we lovingly call ourselves DIPSQA. Here at the Arkansas Department of Human Services, we hold the federal Lifespan Respite Grant for the state of Arkansas here, and also partner with our coalition to do all of the activities that we've placed in that federal grant. You can go ahead. So in the past, we joked that we had a respite registry. It was just a lot like the secret menu at In-N-Out Burgers. You kind of had to know it was there to order off of it. It was originally just a spreadsheet, an Excel spreadsheet that we kept in-house, and providers had to call and say, do you have a list of respite providers? And we could provide that to them. So what we did is we started having the conversation last year with one of our IT vendors here to kind of develop a search engine where our respite providers could go online on a public site and search for that information. What they were able to do was take our information that we had contained in that spreadsheet and display it for us in a more user-friendly and a searchable method. We still use that spreadsheet actually as the back side of our search engine, which controls all of the information that's in there. And we created this through the Power BI software. And it's a more updated and streamlined version of that Excel spreadsheet that people can filter through. Down there at the bottom is the website. We've kind of shrunk that website, which is actually a really long one, so that people can get to it a lot easier. I think Cheryl asked earlier, mentioned something about their AG's office, or someone mentioned not using the word registry. We have the same thing. We're not told not to use the registry, but a lot of registries here in the state of Arkansas are considered bad registries. If you're on a registry, it's because of maltreatment or something else. So we do still call it a registry, but it's also known kind of out in the public as a search locator, just to kind of differentiate that. You can go ahead, Jill. So this is the basic look of our search engine. So when you go to the website and you say, I want to search for a respite provider, this is what pulls up. Again, it's just a Power BI software. And you can see that they can either click on the map, wherever there is a dot on the map, there is a respite provider listed. They can click that, or there are filter options up at the top on the top bar that go through several factors, such as if they already know a provider's name specifically and they want to look for them. We have it broken out if they want to look for a Medicaid or a Medicare provider, a particular age range that's served, or the most commonly used filter, of course, is our county, so that they can kind of narrow it down closer to where they live. Once they click on one of these names, details will actually pop up in that right side of the screen that's kind of blank there, and give them more information. We'll look at one of those here in a minute, and they can then determine if it's a good fit for them. When our registry went live, I believe that was back in October or November of last year, it really only contained established licensed provider organizations that we knew that were providing respite, because we really hadn't figured out a way to verify a respite skill or a knowledge of just any outside individual. We then began participating in the pilot project that Jill talked about earlier for the respite training. And with that, we were able to take that online certification and use it to verify at least a basic knowledge of respite skills, to then place people on our search locator. So if an individual goes in and completes those 10 modules, completes the quizzes, and receives their certification, we determined that's a good starting point for us to verify. They provide that information to us, and then we can also place them on our registry. So it's no longer just agencies, but we are able to put, Susie Q on there if she's gone through that training. And we call those our self-employed or our independent respite providers. Next. So you can kind of see that here. This is, for example, one of our independent providers who's completed our training. She went in, you'll see down here at the bottom, it says, please click the link to access the form and be added. It is an online form that they'll go through and put in all of their information for us, click through some disclaimers and confirmations for us. And then once they do that, it sends an email to us inside of DHS, and we go and we pull their information. We confirm that they've completed the certificate, and then we'll put that information of theirs into our spreadsheet, and our Power BI it regenerates every night. So it will update every night. We usually let the person know that they've been added. Please wait 24 hours and they should see themselves the next day. Part of what we do is we ask them a lot like Wisconsin was saying, we ask them things like making sure that they are responding in a timely fashion. Their profile may be inactive if we find out they're not responding to calls, that they may be required to go through criminal background checks. And they also understand that in no way, of course, this is a disclaimer of DHS, that being on this registry is an endorsement by DHS. Next slide. As far as our screening process, this brought a couple of challenges for us when we were building this. With our licensed providers and organizations, they are already required by Arkansas law to complete background checks and maltreatment registry checks for all of their employees. So if a caregiver reaches out to them and they deploy one of their employees to provide respite, they are required to already have vetted that respite worker through all of the proper channels. But right now, there is no statute in place here in Arkansas that requires these checks for our non-licensed independent respite workers, such as those that we're adding here to our registry. So what we're working on at the moment is to draft new legislation that we're going to take before our legislators when session begins in January, to hopefully lay out what we're calling the Arkansas Lifespan Respite Act, and we'll add that requirement that anyone placed on this registry will be cleared and vetted through our state and federal criminal background checks, as well as the Arkansas Child and Adult Maltreatment Registries. Right now, in the interim, we have a disclaimer on the site for caregivers, just stating that these individuals may not have been vetted, and it is up to them to ensure that that they do if they so choose to. Next slide. As for our pros and cons, the pros are pretty much what we were looking for. We'll finally have something searchable online and accessible 24 hours a day. It is attached to our DHS website, so it's easy for them to find. It does allow the mechanism for individuals to then also now promote themselves for work opportunities, and not just our big organizations or providers that are licensed through the state. And we've also now been using it kind of in tandem with our respite worker training pilot project to promote that training, to let them know if they complete that training, they can get on our registry and promote themselves. The cons are, as you can see, it's still a little clunky. It was built out of the basic necessities of what we had at the time. I know that Wisconsin said theirs doesn't look like Nebraska's, ours does not look like Wisconsin's. And that is a goal that we are aiming for. When we first built it and it first went online, we were already thinking of enhancements that we're ready to do to it. Right now, it doesn't really allow a lot of detail to be shown. When you click on those extra details, or that when you click on it to look at their details, so that is something that we're really looking to enhance with our bells and whistles going forward. And it does require us for that mapping purpose to do a geo mapping to put in longitude and latitude coordinates of the address they provide to us so that it will pull up on our map. This was a bit of a brain teaser with the facilities. It wasn't such a big deal, but once we got to adding our independent respite workers, we didn't want to add their home address for people to know exactly where they lived. So what we do now is we just go and find a generic coordinate for that city and place that in there so it will still pull them. Next slide. And that is really all that I had for today. My information is down here below if anybody has any questions. And that's it. Thanks, Jill.
Thank you, Sarah, so much for sharing that information. So much that's just been done in the last couple of years, so I commend you for that effort. And lastly, now I'll turn it over to Teresa from Rewarding Work, and I'll advance to your slide, Teresa.
Hi, everyone. Thank you, Jill. I'm Teresa Driscoll, and I'm the Marketing and Operations Manager at Rewarding Work. And Jill, if you could advance to the next slide, that would be great. So Rewarding Work was established in 2004, and we were established really for the sole purpose of assisting people of all ages with disabilities and their families by making it possible for them to live at home or in the community of their choice by connecting them to in-home support. So that really remains our single purpose and mission to this day. In 2018, Rewarding Work did become an affiliate of TIL Inc., which stands for Toward Independent Living and Learning. It's an innovative human service agency based in Dedham, Mass. The original founder of Rewarding Work was retiring, and we needed a new home for Rewarding Work. And we fit in perfectly with TIL's mission to support people of all ages with disabilities. I did come, I've been with Rewarding Work since 2008. So we were thrilled to find our new home with TIL. So if you can go to the next slide, please. So basically the way we operate is we offer a shared platform for states that wish to partner with us. So again, we partner with states who want to provide this type of matching services directory. And we work with each state to really personalize the website for their own needs. And if you look at our website, we do often, we use kind of a generic term, caregiver, but we refer to really all types of in-home and community support. And that would include respite workers, of course, companions, PCAs, in-home direct care workers, community support, job coaches, and many others. And then again, one thing that's important to note is that we do not pre-screen our applicants in any way, like the other registries made sure to note. We are not an employer in any way. We help to connect the employer and the job candidate. So that's where our role is, to bring employers and candidates to our website and allow them to connect. And the way we do that is employers would register with us and subscribe. And again, what we do is we work with each of our partner states to come up with the subscription for that state. So for example, in Massachusetts and Connecticut, we work with the Department of Developmental Services in each of those states. So anyone who receives funding through DDS in Massachusetts or Connecticut can use Rewarding Work free of charge. But when we are operating in a state, we also make it possible for other people to use us, even if they don't have that specific funding. So we do have low-cost paid subscriptions available. So for example, someone in one of our participating states who does not have that funding can subscribe for 1 month for $10, 3 months for $25. We've had that same subscription pricing for years, and it's really just to expand access to the website. And so currently we operate in Massachusetts, Connecticut, and in Kansas. And in Kansas, we work with the Kansas Lifespan Respite Coalition, and we work with a group of MCOs who provide this directory free of charge to anyone in Kansas who has CanCare. Next slide, please. So, so our website, we unveiled a whole new website 2 years ago, and our goal was to make it easier and more intuitive for people to use. So this is just an example of some of the types of graphics that we have, but these do quickly describe the registration and application process. So for employers, they would go to our website and create an account. Then they would select a subscription. And as I mentioned, the free subscriptions are determined by the states that we work with. And the way we handle that is, if someone is entitled to a free subscription, we provide an access code that the employer would enter when they register, and that will give them a free 12-month subscription, which is, then renewable. So for employers, after they register and subscribe, then they can immediately search our database for applicants, or they can post a job. Many do both simultaneously. And when an employer searches, they select the state that they're in, and what we do is we work with each state and we customize a list of questions that would pertain to their employers. So the applicant answers that state's specific questions, and then so then employers can filter their search, and really they can search by distance. So they could do just a simple zip code search, but then they can really add you know, different layers of filters to find exactly the type of candidate that they're looking for. And again, an employer can go on and post a job. Our job board is, it's in real time. So when an employer posts a job, the job is listed immediately. The newest jobs go to the top of the job board, and jobs will stay on our site for 30 days. At the end of 30 days, they automatically expire. If an employer has not hired someone at that point, they can renew their job, or they can edit it at any time. When we redesigned our website, we came up with the concept of dashboards for employers and job applicants. So when an employer logs into rewarding work, they'll pretty much have everything they need at their fingertips. They can go in and search, and they can go in and post jobs and manage their jobs and so forth. So then after an employer finds a candidate who they think may be a good match, then that's when they control that process. They reach out and talk to the applicant to see if they're interested, set up an interview, and so forth. And as I mentioned, applicants are not pre-screened, so that would be part of the interviewing and screening process. And we, I know Val mentioned that Wisconsin has a lot of information, and they help employers learn how to properly vet applicants. So we provide a lot of that on our website as well. We provide links to state forms to do background checks. We give interview tips, safety tips, that type of thing. And then depending on what funding an employer may have, oftentimes the background check will be taken over by the funder. So for example, in Massachusetts, if someone has DDS funding, depending again on the DDS funding they have, the background check would be done by the fiscal intermediary before they're hired and put on the payroll. So that's more or less how it works for employers. Applicants can go in and create a free account. They would submit their application and upload a resume if they wish to. So then when an applicant completes their application, employers will be able to find them when they search our database. And then applicants can also view jobs in our job board and apply for those jobs. So for an applicant has to be logged into our system in order to apply for a job, but then that all happens right on our website. And again, then that would lead to the interview process and the hiring process. So, and then just one other important thing we did, we put this into effect a few years ago. We have a 90-day period, so applicants must go in and renew their application at least once every 90 days in order to stay active on our website. And this again is just to ensure a database of applicants who are active and really seeking work at that time. When an applicant is suspended, they can reactivate their application at any time as well. We have a lot of returning applicants who will activate when they're looking for a job, and then they'll deactivate their application. But then when they're looking for a position again, they they just have to log in and activate their application. So that process works really well. Jill, next slide, please. So again, this is more or less just a list of our website features. So it's intuitive, accessible, and responsive. It's mobile friendly. Again, that is something that we added when we introduced our new website 2 years ago. It's ADA compliant. We have easy to use dashboards for people to manage accounts. We have the search engine and the job board. And again, we find that employers and applicants appreciate having both of those tools available to them. We have many automated functions on the website. I think as Stephen had mentioned, it's really important to maintain a good balance of employers and job applicants. So we have a whole system of automated reminders that go out every 30 days. Every time an applicant renews their application, they go to the top of our listing. And finally, so our database is secure. So employers who wish to use rewarding work must register and subscribe to us in order to access job applicant information. Next slide, please. So again, as I mentioned, this is a shared website model. So what our partners get when they work with us is they get full access to all of our website features. We have customized state landing pages for each state. So for example, Kansas would have a Kansas employer landing page, and it would have a lot of specific information just for people in Kansas. And then Kansas job applicants would have a separate landing page. As I mentioned, we customize the job candidate applications. We work with the states to do that. We have customized search filters, the access codes for free subscriptions. Customer support is something that is part of our package. So we have a customer support center that runs Monday through Friday, 9 to 5. And we take telephone calls and answer emails and support both employers and applicants in using rewarding work. And we also often end up directing them to resources in their home state when they have questions that we don't, maybe for services that we're not involved with. We provide, we do have a lot of reporting and analytics on our website. So we provide all of that to our state partners as well. And so then this last item is something, again, it's part of what we offer. So as a shared website model, we're not really, we're not just offering a site to host a state directory where it's really more of a full service model. What we have found is that marketing, outreach, and recruitment is really essential to making sure that the website is successful. So we do a lot of customized marketing materials. We do regular email campaigns, online advertising, and social media as well. Next slide, please. Oh, so that's the end. So I think, so there are a few other things too, that I can mention. So I don't have actual, screenshots of, say, our job board or our applicant search. But for anyone who is interested, you can go to our website, and on our homepage, if you click on hire a caregiver, you can register for a free 24-hour trial. Just to give you an idea of how rewarding work operates. The free trial, you can do applicant search, you can see how the filters work. It will actually show how many applicants are in a particular area, but you wouldn't have, as part of our free search, employers don't have access to the applications themselves. So as part of the free trial, the applicant would come up with using just their first name. And again, you wouldn't have access to posting a job on the job board, but you would be able to see what our dashboard looks like and how to, maneuver and manage the site. So our website was basically custom built for us. It is based on, it's a Drupal site, and we work very closely with a web developer. So it's a very dynamic site. So we are, we're pretty much always in the process of monitoring it and adding enhancements as needed and as requested by our state partners. For example, one item we're adding, which I haven't seen the live site yet though, but we're adding a Google Translate button on our homepage that will translate our website into multiple languages. And that's pretty standard. So that's an easy type of thing to do. But what's great about the way our web developer has gotten it to work is it will go in and it will translate all of our forms, the applicant questions, the filters. So we're really excited about that. So it's just an example of being able to add and enhance our website as needed. A con to our website, I would say probably the sustainable funding issue. And when we do take on new partners, it's really important to talk about funding, because we have operated in other states in the past where we'll be in a state for several years and things are going well, but the funding may dry up. So that again is something that is really important to establish upfront. And other than that, I know there are some requests we get from people that we just cannot do. For example, people have asked us if they can rate job applicants on our website and give them a rating for how responsive they are, what type of job applicant they are. That is something that we're not prepared to get into at this time. So we do what we can just to really bring a dynamic and up-to-date website to people, and we love what we do. So thank you, Jill. I think I'm all done.
Thank you very much, Teresa.
Sure, thanks.
And thanks so much to all of our speakers. We have gone past our allotted time. And I apologize for that. There was just so much good information. I didn't want to cut anybody off. We do have some really great questions in the chat. So if some of you are able to, those of you who must leave, of course, you're free to go. If our speakers might stay for another 2 or 3 minutes just to get through some of the questions, some of which have been answered in the chat, that would be wonderful. We'll stay on for another 3 or 4 minutes to get these questions. There was one that was entered early on, Stephen, if you're still with us, that I think might have been directed to you because it was right after you spoke. And the question was, our DAG has recommended not calling it a registry to avoid liability of qualifying participants' workers. What else could it be called? Does anyone call it a matching service platform, and what does that convey to those using it? And I know, Stephen, you do call them matching services. So I was wondering if you could address that issue.
Yeah, of course. I mean, I think the term matching service registry we developed really just to sort of start wrapping our arms around what we saw as an emerging technology, 10 or so years ago. I think that, there are lots of terms we could use, right? Like a job board, for example. There's a new and emerging platform being launched by an organization called Advancing States. They may be adding some sort of matching service technology to it, and that's called Connect to Care Jobs. So I think we can be really rather creative in how we describe these platforms, because I think outside of our field, the term matching service registry is pretty unknown, right? So, from a branding perspective, it might even make more sense beyond sort of like the legal liabilities to choose a term that's, a bit more accessible to folks. And I think that can sort of come through again through the engagement with potential users of such a platform.
Very interesting response. And I think Sarah responded to that question in the chat as well, that they had similar liability related concerns about calling it a registry, but wound up calling it a registry anyway. There was another question here. Does anyone allow caregivers to indicate stars or score for their experience with working with a respite worker?
Jill, this is Sarah. We don't, but I love that idea, so I took it down as a note.
This is
Anybody
Val in
else?
Wisconsin. We do not either. It's something that the software can do. We had a conversation about it and decided that we didn't want to do it to look at the side of the provider as well. If it wasn't a good match, how does that affect them? Maybe they're a good match for someone else. So we were just very cautious of that and decided not to go that route.
And just to add on, I think this isn't something that we've seen in our research. And I think, Val, the reason that you provide is probably right? That it can also be a challenge that can pose additional challenges for workers at a time when we really need them most. But there are other ways, kind of like middle ground approaches, like, for example, encouraging workers to list or provide references of previous clients. That's another way you can sort of get at this question of care quality and reliability.
Is there a way that maybe you could do it, but it only go internal so that those of us who maintain the registry can see? And if somebody's continually getting low stars or something that we know internally, but maybe we're not sharing it with the world.
Yeah, I think that's a great idea, Sarah. And I mean, that's the downfall of our registry, is because we don't have a way to track specifically who's using it and then who is making those contacts, because we're just connecting people. So we don't have a great system to be able to follow up with the people. Did you use it? Was it a good experience? But I think that's a great idea, is to get some of that feedback from the family caregivers on, did this system work for you? And I think that's a piece that we're definitely missing in Wisconsin, that we've been talking about how to figure that out.
I know on our end, ours doesn't allow us through Power BI to see who's used it as well. The only thing that we've been able to come up with is Through our voucher program, we require them to do a satisfaction survey. And when we send them their award letter, we do provide the link to the registry. And then in the satisfaction survey, we've been thinking of adding the question of, did you find your person through the registry or on your own? And then asking some questions that way. But that's the only way we've been able to kind of think through it right now as to how we can capture who's using it.
So I just wanted to say that we're also adding some automated survey tools to our website. And part of that is because of funding issues through the state. And basically, there's no way, since we don't, we are connecting, so we're not involved in the actual hiring process. So we don't have hard data about who was hired, who wasn't hired. But this survey tool will help us, and it will help us report back to the states who need some, accountability for the funding, about how how valuable it is, and say how many matches are potentially being made.
Thank you for those great responses. One more question here that I'd like to get through before we say good afternoon to you all. Cheryl from Nevada is wondering if the online registries could be improved to assist a caregiver through a life course person-centered respite planning tool. I feel like that's what's lost through these web-based tools, that person-centered approach. And I think what she's asking about is the real ability to make sure you're adequately matching the right person to the right provider. I believe New York might be testing that in a new model they're going to be doing, but I could be wrong. If there's anyone from New York who wanted to talk about using the life course respite tools for person-centered planning for respite. I'm sorry, I didn't mean to interrupt you, Val. Go ahead.
No, that's what I was just gonna say. I think a lot of our registries, how they sit is more so just the connecting, and it's on the end user to make sure it's person-centered and that make sure it's a good fit for them. And so how we approach that again is training those family caregivers, and Teresa talked about that as well, as giving them the information to make good decisions for their families. I think is the best way to do that. If we're not employers, it's really hard for us to say, you are connecting with this person or this person, and to create some of that person-centered needs. So I think kind of the way that we have to approach it is more so giving information, and it's on the families. But I love the thought that there could be more, or there could be something better.
I just wanted to add too that there was one novel approach. It was a private registry that was underdeveloped a few years back that I don't think was successful in the end. But the way they approached this question of sort of person-centeredness and match was almost by treating these profiles like dating profiles. Like there was a questionnaire that both sides would fill out about how they would handle certain scenarios and what their preferences were. And the platform then algorithmically sort of developed like a match score between people. That's quite technologically advanced, right? Like it takes quite a lot of development to get there. But I did think it was sort of clever and interesting.
I think the Nebraska people unfortunately have left us, but I think their system has a little bit of that matching ability as well, but it had more to do with the care recipient's needs than a broader family-centered approach. And of course, Nebraska also supplements their online registry with, they have 6 regions of the state that have respite coordinators who are available to talk individually with people at any time. And they have the resources to do that and have built up their resources to be able to do that. But most of our programs at this point don't have that, unfortunately, have that capacity. Anyway, I think we're really out of time. Thank you very much to all of our speakers, such excellent presentations and so much information. We will make sure that you all get a recording of today's webinar, and as well as the chat, because there were lots of good responses to many other questions that were asked in the chat as well. And I know you'll all want to have that information. So we'll make that available. Thank you all to everyone, especially our speakers and those of you who stuck around to hear all of the discussion. And I hope you all have a wonderful afternoon. Thank you again.
Thank you,
Jill.
Jill. Thank you, everyone.